The introductions I did earlier of the students in the room, I just found out that we also have students here from the North American Racing Academy, so welcome to those students as well. Thank you for joining us. And now if you'll all please give your attention to the president of the Jockey Club, Jim Gagliano. Thank you.
That's very good. Thank you, Donna, and thanks everyone for being here today. I'm going to ask the folks that are back in the coffee room, if you could, Matt, if you could try to get them in. We've got a couple of very important remarks to make. First, I do want to thank all of you that are here today. By our count, it looks like the attendance for this event, which is now an annual event, is up about 50%, which is really encouraging, and we thank you for all your participation and cooperation. This conference is and always has been about the welfare and safety of horses. And I thought we'd be remiss if we didn't address a local animal abuse issue that many of us here have been following these past few days. Local and state authorities, in addition to farms and agribusinesses, have been working since early June to stabilize the situation in Mercer County by mobilizing feed and volunteers to care for those 40 horses or so. And thanks in large part to the immense power of social media, a number of industry organizations and individuals, some anonymously, have enthusiastically stepped forward in the past 24 hours or so to lend a helping hand. This episode once again reminds us of the vital role that groups like the Thoroughbred Charities of America and the Thoroughbred Aftercare Alliance play in our sport. And we should continue to support them and encourage others to do the same. Right now, I'd like to introduce Rusty Ford, who's known to many of you here. He's the equine program manager from the Kentucky Department of Agriculture in the Office of the State Veterinarian, and he's here to update us on the situation. Thank you, Rusty, for being here and for all you and your colleagues are doing to help these horses in need. Rusty.
Thank you, Jim, and as not part of the agenda, and I don't want to get us too far off topic, but I did want to give just a few bullet points. First, I want to thank this group and the work that you all do to the health and welfare of the thoroughbred horses, and actually it's the equine industry in general. You know, when it comes to horses, we're all about the horse, not a breed, and I do thank you for that. Secondly, I want to let you know that this morning when I was updating our Commissioner of Agriculture, Ryan Quarles, and his staff, he too asked me to convey to you all the deep appreciation that he has for the commitment that you've shown in not only this instance, but every day in caring for the horses, because that's what we're all about, is the horse. Thirdly, I want to just let you all know that yesterday, I've worked in the Department of Agriculture for 32 years, and I don't know that I've ever been more proud to be associated with an industry than I was yesterday. I've been working in this environment in Mercer County, or the Department of Agriculture has. We actually defined these horses as meeting the criteria of abandonment. The horses had meet the legal criteria of abandonment. I know a lot of times we get a lot of negative criticism from not moving quickly enough, not moving as quickly and as aggressively as we should. There are processes and procedures that we follow in making the legal cases be able to stand up in court, but what we never do is neglect the horse. These horses, since the first day that we became involved with them, which was on June the 3rd, have been tended to daily. There's a group of 4 individuals down there that were on, in the early days, they referred to themselves as the Golden Girls, were caring for these horses every day. As an example of what they were doing, when I asked yesterday, what's the one thing that I can do today that makes your life easier? One of them said, well, we've only got, a wheelbarrow, and we bring these bales of hay from the bottom of this hill to the top of the hill every day, and it's just about to break our backs. We have a gator out there today, thanks to the efforts of the Kentucky Thoroughbred Association. The other things that we've done is, again, yesterday when I was at the farm, there was recognized for a need for veterinary attention beyond what we could provide in that scenario right there. I reached out to the Kentucky Central Veterinary Committees, had veterinarians on the road. I was actually turning away veterinarians. For every bad apple that I've had, I had 100 golden apples yesterday and a truckload behind them that I said, we just cannot use you today. This industry needs to be commended, and I want to thank you right now. I know that the Jockey Club, the Grayson Foundation, Keeneland, Fasig-Tipton, multiple farms that if I start naming individuals, we'd be here all day, have established accounts and resources for us to care for these horses. One of the obstacles that we were facing, because this was an active investigation, was disposition of the animals. And we've been working through those channels because it is a legal action. Seizure is established with the county, and the county was reluctant to allow any of those horses to leave the premises. Last night, following the assessment of the 43 horses, we did identify 3 horses that desperately needed to be in an environment that could provide more individual direct care. Another 3 horses that could use the added care as well. The remaining population were doing quite well in the environment they were in with the resources that we'd been provided or that the industry had provided. I'm happy that just 5 minutes ago, I received the word that the county has agreed to allow us to move those 6 horses to the Thoroughbred Retirement Foundation. So it does show that you can get different aspects of government, industry, health officials all working together with one common goal, and that's to preserve the health of these horses. And we've done that today. As a summary, and I know I'm just about out of time, but we're almost there. As a summary, we had 43 horses on the premises yesterday. 6 of those horses are going to be off-site. 3 of them are, I think there's trucks on the way to get them now. The remaining horses, we'll have to work out the logistics. During the interim, they will continue to be maintained and have their daily needs met. Of the 43 horses, we did describe, and I said earlier that we had a team of veterinarians come down there. It was 4 veterinarians. I had 2 state veterinarians and myself, along with several volunteers, went through each of the 43 horses and did a thorough evaluation and assessment of each. 3 of the horses we did describe to be emaciated with body condition scores of 2 or less. 10 horses were underweight but manageable. 14 horses were of a suitable weight, and surprisingly, 8 horses were described as overweight, and 8 horses were in that ideal body condition score of roughly 5, thereabouts. So, we've made progress. I think when describing the conditions that we found yesterday, you cannot lose perspective that these horses have been provided care daily. And so you can see that well over 50% of the population is in a suitable condition. 3 horses, and those are the 3 we're moving out tonight, do need more extensive care. They will be given that care tonight. 3 additional horses will be elevated in their care as well. So with that, I think it about summarizes the comments, unless you want to take questions, and we won't comment on the investigation, but anything else I can mention? Thanks.
Well, as you can imagine, since Rusty just got this phone call 5 minutes ago, this is all a developing situation, so we're really not in a position to take any questions on it, but we do appreciate those comments and the updates. So we're going to go ahead and move along to our format. And to talk about biomarker research, please welcome Dr. Christopher Kawcak. He's the professor of surgery and director of equine clinical services, Orthopedic Research Center at the Colorado State University.
Thank you, Donna, and thank you for the invitation to this meeting. There's a couple things I want to do. There's been about 20 years of biomarker research focused on the horse itself specifically, and I want to be fairly concise in how I describe that. We'll cover both fluid markers as well as imaging markers during this. When you look at the definition of biomarkers, NIH has come out with a fairly accurate, I think, description of it, and it's really a characteristic that you can objectively measure as for normal biologic processes, pathologic processes, or disease, and then response to treatment. And when we look at the horse, especially the racehorse, there's a number of things we need to keep in mind, and I'll refer back to them as we go through this talk. And one is, you know, the young thoroughbred racehorse is a fairly amazing adaptive type of animal. In other words, as they train, the musculoskeletal system adapts rapidly. So we need to keep that in mind and be able to assess that using the biomarkers. And we have to differentiate that from a pathologic or a disease process as well. They can potentially help us diagnose a problem, monitor response to therapy, even if that's just rest. But probably one of the most important things that we're wanting to look at is how it can hopefully prevent catastrophic injury that's unique to the horse. There's been a lot of work done on this, and we're actually have benefited significantly from the human side. For several years now, there's been the Havemeyer Foundation has sponsored meetings focused on biomarkers specifically for the horse. And in those meetings, the organizers have actually been able to leverage some of the foremost leading experts in the human field to come and visit. And it's quite entertaining to see how engaged, focused, and excited these human researchers are about the racehorse and how unique the horse is and how it is such a fascinating field that we're studying. And from those meetings, there's usually a report, a summary from the different areas. It could be everything from biomarkers that are molecular in origin to biochemical, the imaging biomarkers, and those have been reported on recently in the last year. When you look at the racehorse itself, the thoroughbred racehorse, they're unique in the sense that most of the injuries are from repetitive stress. So in other words, the stress to the limbs from training, from racing, accumulating over time will then result in a fatigue type of injury. And we know that. A lot of the work that we've done, the work by Sue Stover and her group, the work done in Europe as well, has shown that these are rarely just one-time type of monotonic injuries. They're repetitive stress that build up over time and result in the actual clinical presentation of the injury. The one area I'll focus on today, especially for the imaging component, is on the fetlock joint. We know that the fetlock joint can undergo a whole host of disease processes, the worst, of course, being the catastrophic injury that results in needing to have an ankylosis or fusion procedure of that joint. And again, we know that a lot of these disease processes that occur in the joints actually start in the bone below the joints. So we have this repetitive or adaptive model that occurs within the bone, and we can take advantage of that process in order to characterize what's happening. The biomarkers we'll talk about that are out there are the fluid biomarkers, blood, synovial fluid, and urine. And then imaging biomarkers, and we'll talk about a whole host of different things that are being investigated right now. The one I won't go into detail about, but will mention, as Dr. Peterson had mentioned earlier, these IMUs, or inertial measurement units. There's a lot of work going into being able to characterize the gait of the animal. In fact, the two biggest companies that are looking at that right now, at least for humans, are Nike and Under Armour. They're putting millions of dollars into these wearable technology that people can use to characterize their gait and how that changes over time to be able to not only optimize their performance, but to also be able to be an early indicator of a possible disease entity that's emerging. Again, it's important to understand that especially the thoroughbred racehorse is a rapidly adapting model as they train. They're remodeling their bone, they're strengthening it. The same thing happens in cartilage, tendon, and ligament as well. Probably not as rapid as it occurs in bone, but it definitely occurs quickly. The problem is that the disease processes take advantage of that remodeling cascade. So if there's micro damage or some sort of maybe too much training or too little training for that particular horse, that could have a negative influence on that adaptive process, and that's typically where we get the injury occurring. So it's important that when we look at these markers, whether it's imaging or fluid, we understand the normal adaptive process and what happens. When MRI first came out for horses, we weren't really sure whether some of these changes were due to a pathologic process or were normal. So again, some of these things we need to be clear about when we look at them. So to start with fluid markers, again, this is usually blood or synovial fluid or urine. what you're looking at is the actual biochemicals within those tissues. So bone, cartilage, tendon, and ligament are all collagen-based. Collagen is an actively turning over type of chemical. So in other words, it'll remodel and change over time in order to adapt to the stresses that are placed on it. So you can have newly synthesized collagen, or you can have collagen that's breaking down. You can take advantage of that by measuring the factors that go into either building up collagen or the factors that come off from it breaking it down. When you look at bone, you can look at how rapidly that bone mineral is changing. When you look at cartilage, you can also look at the GAGs, or the chondroitins and the glucosamines that are within the cartilage itself. So you can take advantage of those cycles. The real first proof of principle study that was done for fluid biomarkers in horses was done by Dr. McElraith over 20 years ago, and really just wanted to see, look, can we be able to identify those horses with joint injury through fluid biomarkers, through blood and synovial fluid? And in fact, could. There were 2 markers that they looked at that were indicative of change in the articular cartilage, and we're able to tell basically that those 2 things did change in horses that had damage within the joints. That was good. So proof of principle, knew that it was worthwhile carrying on. Then we need to better understand, well, what is exercise itself? What role does it, or what influence does it have on markers? And sure enough, it was significant. You could see a significant change in these biomarkers over time as young horses were starting to adapt to exercise. So again, you have to look through that adaptive process in order to identify those horses that may have a disease state. We then went on, led by Dave Frisbee in our lab, to be able to differentiate horses with disease from training. And so we compared, with treadmill training, compared a group of horses with joint disease and those without. And we're able to, find 6 synovial fluid and serum biomarkers that could differentiate between those. And you knew the study was working well because the biomarkers all changed in all the horses during exercise. We know we were seeing that adaptive process, but during that adaptive process, we were to be able to pull out and identify those horses that had joint disease. So again, proof of principle that we could identify disease processes through this kind of the fog of the adaptation that occurs in those horses. Dr. Frisbee then went on, and he and Dr. McElraith performed a prospective study with Drs. Arthur, Blay, and Baker in California, and really wanted to put this concept into play from a clinical standpoint. And so they looked at a group of racing thoroughbreds. They followed them over time, and collected blood and synovial fluid on them during that time. And those horses basically diverged out into a control group, those who had trained and raced successfully, and those that ended up with some sort of musculoskeletal injury. Everything from a chip in the joint to tendon ligament injury on down to buck shins. And we're able to find that there were significant changes seen in those fluid biomarkers based on the injury that occurred. And when you get down to the most significant part, they were able to identify those horses that would undergo an injury in almost 74% of the time. Not perfect, but still a very good, say, surveillance type of system to where you can identify those horses based on those fluid biomarkers before they actually became injured. So again, you're looking deep into that process beyond just your clinical exam. There's other type of fluid biomarkers. The ones I've been talking about so far are biochemical markers. So in other words, those are proteins that are released or basically synthesized by the tissues. You can also take it down to the molecular level. And in this case, this study in particular, led by Dave Frisbee, again, it's found that there were 22 genes that were upregulated in those horses that had joint injury. And we say genes, we're not talking about the hereditary component of it. We're talking about how the genes may change over time or be expressed over time in order to upregulate a certain protein. The thing that's interesting about this, and it's been stated by some of the leading researchers in the human field, is that the biomarkers, even though you'd like for them to make sense, they don't always have to. So in other words, if they change consistently and persistently during a disease process, that's good enough to take advantage of them, to be able to use them as an indicator of injury. So that's a very quick synopsis on the fluid biomarkers. The others that we look at and others are looking at are the imaging biomarkers. Can we do better beyond X-ray, ultrasound, bone scan to be able to identify those horses that may be predisposed to injury? And the human eye is very good at detecting structural change in the musculoskeletal tissues when they occur. But the problem is they have to occur. So you already have a change in that architecture in order to detect that with X-rays or ultrasound. The question is, are there changes that occur below the resolution of the human eye in order to be able to take advantage of those? Nuclear scintigraphy is a good example. A lot of these horses that undergo a bone scan may not have radiographic or ultrasound changes evident. And so it's a nice early surveillance type of system that you can characterize what's happening within the tissues. It's highly sensitive, but not very specific as far as what's going on in those tissues. You just know something's going on. MRI, again, is a very complete volumetric imaging technique, really tells you what's going on down into detail. Sarah Powell and her group in Newmarket have done a great job in using the standing MR scanner to really influence how they practice. But again, you still need some structural or physiologic change within those tissues in order to characterize that a horse has a particular problem. We've been looking at computed tomography, and there's a lot of movement in the computed tomography field in equine right now. I'll cover that in a minute, but it's an area that is moving rapidly. A number of companies that are trying to accommodate CT in the equine field. And what's nice about CT is it's a very rapid type of process to acquire an image. Takes just a couple of minutes to actually scan them. And you can do a number of things to manipulate those images, as I'll see in a minute, at least to try to enhance diagnosis. This is one of the first CTs we did on a post-mortem sample probably over 20 years ago. And this is color-coded for density, and this particular horse had a severe condylar fracture in the opposite limb. We scanned this side, and what you see is the blue is the high density, yellow is the low density. And when you look at this horse, you can see a tremendous amount of increased density built up on the medial or inside front part of that cannon bone, and relatively no density on the back outside part. I don't have a pointer, but it ends up demonstrating that this horse was abnormally loading this particular limb, which is evident by how the density has changed in that. The image on the left is a section taken through that CT from another horse. You can see he's got the blue in the midst of the green area is the blue, which is a small condylar fracture, and then a horse with palmar osteochondral disease on the right side. So it can be quite sensitive. The other thing that's interesting is that there's some indication, some of the work we've done looking at training or not training young horses is that there's some indication there may be an area that's predisposed to injury, at least say with condylar fractures, for instance. And what you end up have happening is an area, I'll go to the next one, you have an area of decreased density where they typically get condylar fractures, and what you end up seeing is you can have normal bone on both sides of that, but you actually have active remodeling or woven bone or weak bone in between, right through that area where they fracture. The point of that is that CT may give us the advantage of being able to identify horses that have that certain pattern of bone density in order to either modulate their training, rest them, or maybe even find another career, hard to know. So then the question came up, what makes some of those young horses predisposed to that type of density pattern? And when the more we looked at our postmortem samples, similar to California, Colorado we do run a mandatory postmortem program. I've been involved with it for the last 20 years. And when we start looking at the end of these cannon bones in the fetlock joint, you see that not all of them are made the same. The one on the right has a fairly symmetric configuration to it, where the one on the left has a very small or relatively small lateral condyle. It's thinner on that right side of the screen on that particular one. And so we started looking at that closer, and with funding from the Grayson Jockey Club Foundation and working with Tim Parkin, we were able to see, at least with fairly crude measurements, that indeed those horses that had condylar fractures had a relatively smaller lateral condyle than those horses that didn't. And not just only in the fractured limb, but also some changes in the non-fractured limb as well. We felt we were onto something, but we weren't quite comfortable with how sensitive the measurement system was. We started collaborating with a group of researchers in the human field that use these complex statistical shape models. They've used them in humans to identify people who are prone to osteoarthritis of the knee. When you look at these images, the color coding indicates how much different those who are going to get osteoarthritis are from those who aren't. And the area it's really been helpful in the human side is in the hip. Those people who are predisposed to hip fracture as they get older have a change in the geometry of their femoral head as well as a change in the density. And so again, it's an early indicator to be able to act upon doing something for those people, so hopefully they don't fracture. There's been a little bit of work done on statistical shape modeling in horses. Chris Riggs and his group in China have done a small study looking at shape changes in the sesamoid bones in those horses that fracture, and indeed saw a 3.5 millimeter change in the length of those bones in those horses that fractured. Now that's a lot to ask for when you're looking at an x-ray, but now we have some of these computer models that can indeed discern those differences. We did a proof of concept study last year looking at can the condyles, can the bottom of the cannon bone actually change shape in an adult? And it can. In this study, we were able to change the shape of the condyle upwards of about 1.5 millimeters, which doesn't inherently seem possible, but it does in fact occur. And it doesn't only occur in horses, it occurs in other species as well. So again, another tool that we can possibly use, if you can get a CAT scan on a horse on a regular basis, that's going to be the challenge. Then you can use these type of modeling traits fairly easily to characterize and try to identify those horses that may be at risk of injury. The other area that we look at is similar to what they do in the racing industry and in auto racing, and that is build a model that basically determines the stress that's placed on a particular object. So in this case, our group, as well as, again, Dr. Stover's group at Davis, have worked to create what's called a finite element model, and it's a model of a structure that tells you where the stresses are, where the abnormal stresses are. And in this particular case, we can see that at a gallop in a thoroughbred racehorse that at maximal weight bearing, they do put a tremendous amount of stress in that area that fractures in the condyle. So again, another thing that if we can acquire the images, we can possibly use these techniques to look at them or to evaluate them. What are the market factors, though, that prevent us, or at least barriers to acquiring these images? One is cost. You need something that's fairly low cost, fairly sustainable, and can be used on a repeated basis. As I talked about with the fluid biomarkers, you need to acquire them on a repeated basis to see how the blood levels change over time. It's likely the same with the imaging as well. It needs to be easy to use. The horse needs to be able to get in, get out with relatively little influence. You don't want to have to anesthetize them to do it. The development, we're a small industry. When you look at the medical industry and trying to leverage companies into working with you to develop these markers, it's virtually impossible. Dr. Bramlage and I had an example of that a couple of years ago. We were working with a company to try to build a CAT scanner you can use in a standing horse, sedated horse, so you didn't have to anesthetize them. We got all the way up to building a mock model of it with a full-scale replica of a horse in it. We were good to go. We thought, okay, this is easy. They'll dump the guts of it in there and we'll be good to go. The board of that company then had their annual meeting a couple months later and decided to basically table that because it wasn't a priority. They had other human health priorities that took advantage of this. The market's not big enough for them to sell enough of these to make it financially justifiable. That's reality. Unfortunately, it's the same on the fluid biomarker side. It's hard to leverage these companies that have the capacity to do this to make this a priority, because obviously they have a number of factors they need to work with on the human side. So when we look at standing CAT scanners, that's a direction that many people are going right now. The first scanner was a simple fan beam scanner and was used, but took a long time to acquire images, was rather slow. And as you can see on the left, you did have to place the horse's limb within a ring, a fixed ring, which I think most of us would identify as a little bit concerning for the horse's well-being. Since that time, when you look at the top left of this screen, you see two different types of CAT scanners. On the left is the configuration for a typical CAT scanner. They put you on a table, they move you in, it takes the image slice by slice. On the right side of that image is what's called a cone beam scanner, and the patient doesn't move. And if any of you have had dental work where you needed implants in your mouth, you've probably sat in a CAT scanner typical or similar to the one on the top right of the screen. The maxillofacial industry has used cone beam CT for a couple decades now, and it's a single spin around. You don't have to move. It's quick, so upwards of 30 to 45 seconds, and you acquire a three-dimensional image or a CAT scan. On the human side, there's colleagues of ours at Johns Hopkins that have developed this for the human. And basically what it is, on the right side, you see it's basically a digital X-ray system and the panel can acquire images rapidly, and so that can spin around. The other beauty is that it doesn't have to spin all the way around. In fact, we've got it down to about 220 degrees, so it can fit around a horse's limb, and we feel in an open configuration can safely image those horses. This was buried in this was the prototype at Johns Hopkins on the human side, and there's an equine cadaver limb inside that tube. It was quite entertaining walking through the hallowed halls of Johns Hopkins with a cadaver limb, so we had to kind of hide it. But what you see here is the CT unit that we have at CSU. The image on the left side is from that. The image on the right side was from that prototype. And with cone beam, your bone detail is very high, higher than it is with a typical fan beam system based on how the algorithms are written. You can also get soft tissue imaging. Again, this is from a fetlock joint of a cadaver, and you can manipulate the algorithms in order to acquire fairly decent imaging. You can administer contrast into the blood vessels and start to look at the blood supply in these different areas. There's also dual energy CAT scanning that you can actually acquire quite good images of the soft tissues. Everybody thinks CT is for bone, which it's very good at bone, but now with the way the physicists are manipulating the images, they can start to acquire soft tissue. The top left here is looking at the cruciate ligament in a person, the ligaments and tendons around an ankle. And one of the benefits of MRI is being able to look for bone bruising. And in these distal limbs of these racehorses, there's a fair bit of bone bruising. The dual energy can also be used to pull that information out as well. So there's a couple of devices on the market now. On the top right is this Pegaso unit from Epica. Again, you still have to anesthetize the horse to put it in, but it is a cone beam system. On distal limbs, it works very, very well, and that company is working on an extremity device that can be used in a standing horse. On the left is the 4DDI system. Most of you have probably seen this. There's one at Penn and one up at Ruffian. And they work very well. And in fact, I know that Dr. Yarbrough up at Ruffian has just demonstrated he can acquire distal limb injuries or distal limb images, CAT scan images, and has diagnosed an incomplete condylar fracture using that system. So it's out there, it's being used, it's something that, again, we can take advantage of those data to really start to further characterize the chances of a horse undergoing an injury. PET imaging, this is another modality that is being looked at deeply. I know the Grayson Jockey Club is supporting this work as well. Matthew Sprie, a radiologist at UC Davis, is looking into it. If anybody's been unfortunate enough to have a PET scan, it's usually because they're looking for metastasis for cancer. But in this particular use, you can actually find subtle soft tissue injury and possibly bone and joint injury by using this. And it's a low-dose radioactive dye injected either systemically or regionally, and you can start to pick up very subtle, very early changes, especially in the soft tissues, using this modality. So again, something that's being adapted for the horse. Spectral CT, that's another thing that's on the horizon in the future, and it not only tells you the density changes that occur in the bone, but you can actually start to look at chemical changes. We know from some postmortem work that a lot of these horses that are injured actually have a change in the chemistry of their bone. And so again, this may be another method that can help us detect those changes in the future. So again, when we look at biomarkers, I think the take-home message here is that you're going to need to sequentially analyze these animals over time. It's done in the human field. It's done if you have say people with prostate cancer, they get a PSA done. That PSA is followed not only to diagnose the problem, but also to monitor their response to treatment and any indications of recurrence. It's going to be the same thing for biomarkers. For athletes, you're going to have to follow them over time, not only to diagnose a problem, but to also manage those athletes as they go forward, whether you're changing them before they become lame, changing their work, or monitoring them after an injury. And again, that's something that the industry is going to have to recognize and be able to engage and support. And again, the technologies exist. These CT scanners, the biomarkers, everything, they're there, ready to go. But the problem is, again, we are a small market, and when you talk to these bigger companies, especially from the human side, it's oftentimes difficult to leverage them or convince them that this niche market is important enough for them to put resources into to be able to support it. I have to admit, though, the companies that are, the two companies that have developed the system so far, and there's two others out there that are looking at developing systems, are veterinary-based. They're basically equine-based, and they're putting a fair bit of resources into making this happen. And then we need to look at a sample bank. This is something that came from the last Havemeyer meeting, and really once we get these things up and going, we then need large numbers. Again, when you look at the human field and the massive clinical trials they run, we don't have that capacity. So what we're trying to do is get our groups together, bank samples, blood, synovial fluid, urine, and be able to make some significant or at least accurate conclusions from these studies over time. So what may work, when we discuss how biomarkers may work for us, I think probably blood and synovial fluid, especially blood, easy to acquire. It's acquired all the time from these animals. It'd be nice to follow those. If a horse comes into it, basically shows up as a blip on the radar, his numbers are a little abnormal, then that's the horse you then carry on and do more, say, imaging techniques or something to better characterize what's happening with that horse. So that's all I have. There's a number of acknowledgments here. I think the one that's significant, certainly significant to me, is the Grace and Jockey Club Research Foundation. They've supported a lot of this work, not only in our lab, but other labs, to really take a hard look at how we can try to identify these horses before they injure. I'd be happy to take any questions.
Sorry, mic problem there. We've had a lot of questions, but we just have time for one. That's all right. What are the practical applications of identifying the risk of disease in horses with unusual density patterns or condyle shape?
Can you say that one more time?
What are the practical applications of identifying the risk of disease in horses with unusual density patterns or condyle shape?
Yeah, it's a good question. So I think the most difficult thing, when you look at practicality, it's acquiring the images. But I think, again, with these companies that are trying to develop these extremity scanners, once we can get to a price point and a usability point with these scanners, as these horses come in, then again, that's where these biobanks come into play. You can start to then acquire these samples. Once the CT's done, it's a digital record, and so you can start to take those. And what they've done on the human side, which I think is very doable on our side, is with the osteoarthritis initiative in humans, they've acquired hundreds of thousands of MRIs, CTs, fluid markers, and those. And when you start to have those type of numbers, you can then start to look at shape and density patterns. People always talk about abnormal density in horses, but none of the data has actually been able to identify a density range or a density pattern that's pathologic. And so when you can start to acquire the images on a regular basis, then I think at that point you can start to practically make some conclusions about what they mean.